I just want to talk to some of the newcomers who have just found out about having iron overload disorder or hemochromatosis. It's probably a pretty big shock to you at first because it was me when I first was diagnosed. I was having troubles with gout, heart palpitations, joint pain, skin discoloration, all sorts of, and my blood sugar was up and down and all over the place. And I would give blood, a pint of blood for every 6 days for, God, it was at least 2 months. And I was wiped out. You're going to feel drawn out. You're going to feel like awful and nauseous sometimes. The big thing is hydration. Keep the fluids in you. Fill yourself and drink the night before. That's the big key. Your body's got to have time to absorb all that water, and make sure you stay hydrated, because if you don't, being stuck in that chair for long periods of time is horrible. So I'll explain hemochromatosis real quick. Hemochromatosis, for those who don't know what it is, as I said, your body overloads with iron. What it is, let's put this in a little perspective. So a normal person who eats a steak, right? There's that much iron in that steak. So when you eat that steak, your body takes in that much iron and then gets rid of the rest through natural processes. Now, people with hemochromatosis eat that steak, and that steak has that much iron, and they get rid of that much iron through natural process. So what's the body do with the rest of this iron? What's it keep? Well, the first thing it does is start loading up your soft tissues, the softest points, your liver, your kidneys, your pancreas, and parts of your heart, your lung afterwards, and then it just radiates out from there. Now, you can research all of this quickly and find it all online. The thing is, if you don't take care of it, you will end up like I did with all these issues. And luckily I found it in time. If I wasn't a drinker, because I was going through all these problems, the doctor said, gave me my gout medication, wrote it out, and he got me good, because he was like, okay, here's your gout medication. And he starts writing another one. He goes, I post-dated this for a year because that's going to be for your kidneys. And this one will be in 3 years. And then he writes another, this one's for your blood pressure. And this one's for your cholesterol. He goes, I'll have you on at least 6 medications before you're 45. Well, that floored me. So I quit drinking. And a year later, my liver was in shutdown. It was starting to fail. So he swore up and down that I was drinking. And I looked at him. I said, look, I'm being honest. I quit drinking. I haven't had a drink in over a year. Don't do any of this drugs, or I don't take pills. I don't do this and that. So they ran a gamut of tests, herpes, thyroid. And I mean, the list was huge. I went through a huge amount of blood tests. And then finally said, I went and saw him one day to find out what's going on, to see about liver treatments and maybe whatever. And he was talking about the future being a transplant, whatever. And so he goes like, I got a friend out Midwest. Let me call him, and I'll let you know before the day's out. So he went. I signed out my prescription for whatever, and I went, got in my truck. I wasn't even 5 minutes down the road, and he calls up and says, he wasn't in 2 minutes, and said, hemochromatosis. I need you to go to the hospital, get your blood work done immediately. I called them, and they're going to get you right in. So I go in, and sure as hell, I have genetic hemochromatosis, and found out that my body was over 1,600 in ferritin. Now, 1,600 in ferritin is pretty big. It's not the biggest I've heard of, but it was causing a huge amount of trouble. Keeping below 400 is when organ damage starts to occur. So you've got to be below 400. The best is down by 50, 60, so on and so forth. But sometimes you need to take a break to regain your strength, because when you take blood out, it doesn't just get rid of iron. It gets rid of a lot of things. Now, another thing about hemochromatosis is I've heard doctors tell their patients who are completely ignorant of this disorder, and I do say ignorant because they don't know shit. I've heard, and I've got a lot of friends now that are starting to find out that they've got this, and I've heard all sorts of stupid shit. One of the most stupid things I've heard was a doctor looked at him and said, eat whatever you want, because you know what? Everything has iron in it. Well, maybe. That's probably true. But you know what doesn't have a lot of iron in it? Mom's Best cereal. Certain pastas have less than 3%. There's all sorts of things. I got rid of red meat out of my diet. And that is bullshit for a medical professional to tell someone it's okay to eat anything you want. Look at some of these cornflakes or whatever. I can't remember what cereal it was, but I was shocked to find out that it had over 100% of your daily allowance of iron in half a cup. Now, if you like that cereal, that's an entire day's worth of iron. And if you eat that every day, you're loading yourself with iron. It's crazy to even eat it. So for a doctor to tell you that eat whatever you want, it doesn't matter, is irresponsible, ignorant, and just plain right stupid. I have also taken and naturally lowered my blood iron levels by watching what I ate and very closely monitoring my iron levels and what I would take in. And I didn't give blood for about 3 or 4 months, and I naturally, and I do mean naturally, brought down my iron a large amount. Now, could I continue to do that? Yeah, but if anyone knows me quite well enough, I love my food too much. I love a good piece of meat, but I don't eat red meat. That was the one thing I could get rid of because, yeah, a good cut of steak was good, but it's so friggin' expensive. So getting rid of the steak, I've been able to keep things down. Getting rid of all the processed cereals, I've been able to even manage it better. So I'm at a maintaining level of 3 to 6 months of blood, but I haven't been able to go because my insurance lapsed, and now I'm in some weird bracket where my insurance costs more than anything I can afford, my rent, and so on and so forth. So in order for me to go give blood, I have to see a medical professional because it's a genetic disorder, blah, blah, blah. You need to write your senators. You need to go through all this stuff. We've got to be able to have people take our blood because it costs me about $400 to $500 every time I give a pint. Now, I've got 3 kids at home. I'm a single dad. That I can't do that. So I've been trying to find ways that I could now do it myself. And that scares the hell out of me because I don't know how to stick myself. But I'm telling you, I'm thinking about buying the medical supplies myself, training myself and learning how to do it, and then just draining myself every 3 months. Because at $400 something a whack, that's insane. When people are needing positive blood, I don't do drugs, I don't drink, I don't do any pills, I don't do anything. So yeah, my iron levels in my blood are huge. But what about an anemic or someone going through chemo or something that needs a little transfusion that could use that extra iron? You know, it's crazy that America won't take our blood. So we need to be proactive, anyone who's been diagnosed, and figure out ways that they can take our blood and utilize it. This one person that I used to go to on a regular basis because she was a wizard with a needle, she told me that she had 30 patients every week. That's 30 pints of blood a week thrown in the trash. That's a huge number. So that's 120 pints of blood a month that is just put in the incinerator. It's criminal. It's insane. And when it could be saving people's lives, it could be doing so much, but we throw it away and charge the daylights out of people like us with hemochromatosis. So, and then that's kind of what I have to offer for you, because yes, you can bring your iron levels down. Don't just listen to your doctor. Follow your blood levels, write them down, keep a journal of them, and pay attention to what you eat, because, you know, having a steak every couple of weeks isn't going to kill you, no, but it will raise your blood level a little. You can eat what you want, but as I found out, as I started eating certain things again, instead of every 6 months, I was down to every month. So you can eat whatever you want if you want to give blood every few weeks. So pay attention to what you're doing. Keep yourself healthy. Watch your symptoms. Join a chat group like on Facebook. There's a really good one on that I'm a member of. And there's so much information to be had. My blood sugar, when my iron levels are down, are completely done. There are sexual ramifications from the iron that is huge, especially if you got a loved one that all of a sudden has noticed certain things happening. Do your research. Keep yourself informed. And by all means, keep healthy, friends. And let me know what you think.